Hello everybody and welcome back to Valley Life. I am Rich Krebs and really excited to throw out a new term to you. You're all familiar with the term chiropractic, and there are different practitioners of chiropractic medicine. However, peripheral neuropathy, you may not be familiar with that term, but you're about to be, because I'm going to introduce you to Dr. Russell Horine. Doc, how are you?
Real good, Rich.
Good. I'm very excited to speak to you. I've heard great things about what you're doing in managing people's pain and discomfort. But the term that you kind of use to encompass a lot of where that pain could be coming from, peripheral neuropathy. What exactly does that entail, and how many different ways does it manifest itself?
Well, peripheral neuropathy is extremely common. There's approximately 20 million Americans that suffer from this condition, and the number is increasing every day. A lot of people have this condition and don't even know it. And the symptoms can range from pins and needles in the toes to feeling like they're walking on broken glass or hot burning sand. They can feel like they're walking on thick cushions where they can't feel their feet. They can have actually pain and numbness at the same time, which I know seems kind of contradictory, but it's actually very common. Their legs can become feeling real heavy, and weak, like they're walking through thick water.
Sure.
The real problem with this is peripheral neuropathy is not just about the feet or hands. When a person suffers from this, they can also have neuropathy in other areas of their body. That's called autonomic neuropathy, and that's where it affects their internal organs. So a lot of people come in here with foot pain or hand pain or foot numbness or hand numbness, and they don't realize that that's not their only problem, that other nerves are being affected as well.
Got it. And the central nervous system is basically the body's own way, too, to communicate with itself. So if there are problems, like you said, that happen to be manifesting themselves in the feet, but then you find out that your liver's being affected, your pancreas is being affected, now you've been pre-diagnosed with diabetes, there can be other issues that are coming in where a lot of it treated together can all of a sudden turn the page where you feel so much better.
Sure. In working with neuropathy, and specifically chronic distal polyneuropathy, which we commonly call peripheral neuropathy.
Much easier for people like me.
Yeah. And what happens is it's usually progressive. So it starts off slowly with just kind of minor symptoms. A lot of my patients say it started off 10 years ago when they thought that maybe their shoes were too tight, or maybe they thought they had like rolled up socks in their shoes. Okay. And they got orthotics and other types of treatment thinking that it was a foot problem. And then, of course, the condition progressed further and further until it became full-blown neuropathic pain, or more importantly, numbness, which is much more dangerous. Because, see, the number one cause of death for senior citizens in the U.S. is not strokes, but is falling. Okay. When you can't feel your feet, you can't walk well, and the risk of falling is pretty high.
Well, some of the issues you've thrown out that people have described as being problems they're having kind of gets us back to the root of your practice, that it's not treating the diagnosis, it's treating the patient. You like to kind of look at the big picture so you can get a good clue as to how you're going to actually manage their pain and discomfort and find ways to help them get better.
Exactly. The approach that I take is a fairly comprehensive, multi-layered approach, because to work with peripheral neuropathy, you can't nibble around the edges. In order to be effective, you have to be aggressive. So when we look at this condition, we actually approach it in a very comprehensive way. We work with it metabolically, we work with it musculoskeletal, and neurology as well.
Okay. Well, actually, let's just go right to some testimonials. I don't want you just taking my word for it, but listen to what these people have to say about what Dr. Horine's done for them.
For about 4 months, we did a real hardcore 4 days a week for 4 months, and I noticed relief within the first week. It was incredible with the therapy and the just the really neat things that they do in the office. It was just incredible. I was looking forward to it because it felt like I was, going to a day spa. It was incredible.
And I can feel my feet now. As a matter of fact, this morning, when they gave me the laser treatment, my feet were tickling. I felt ticklish. I hadn't felt that sensation in many, many, many years. So this has tremendously helped me, and so I'm very pleased.
I've been to several neurologists, and they all confirm that I have neuropathy, which is something I already knew, but none of them offer any suggestions or any therapies other than maybe take meds. And the meds were basically for pain. Actually, I don't have a lot of pain. I just have numbness. I have a hard time getting around, and it's not what I envisioned at this time of my life, since I am now retired. So after doing a little bit of research and trying some other therapies, I decided to come to Dr. Horine's office, and I have found a lot of relief in the therapies I have had here. And the great thing about this office is there's always something new on the horizon, because the doctor keeps checking on all the new latest possibilities that come along. So it gives me kind of hope that I can actually stop this, slow it down, maybe even reverse some of it.
And so if you're feeling any pain or discomfort, maybe you've even got some symptoms you just like to get checked out, you need to call Dr. Horine for a consultation and just see if you can get to the root of the problem and see if he can help you to manage some of that pain and discomfort. Don't go anywhere. There'll be more Valley Life coming up right after this.